Hi, everybody. I'd like to welcome you to our next video in the podcast series we're calling Wrangling Parenthood, presented by Chisholm Trail Pediatrics. And we are here with our expert, Dr. Andrew Cavanagh, again, talking about another COVID-19 vaccine, specifically in regards to administering them to children 6 months to 5 years of age. But first, as you can see, we are on location today. That's right. We're at Jimmy Vega's restaurant in Georgetown. If you knew the founder of Chisholm Trail Pediatrics, Dr. David Ramsey, his son, James Ramsey, is actually the owner of Jimmy Vega's Smokehouse. A couple blocks off the square in Georgetown. Highly advise that you come check them out. So we appreciate Jimmy Vegas for having us here today.
Absolutely. It is delicious. The best barbecue.
Anyways, in regards to the COVID-19 vaccine, Chisholm Trail Pediatrics has decided to offer this vaccine for its patients. We're going to be doing the Pfizer 3-dose series, and we wanted to give some information out to the parents out there making this decision. So, straight up, the $1 million question: do you recommend it, Dr. Cavanagh?
So you're giving me $1 million. I love it. Just saying there's a chance. Well, when you're looking at a vaccine, early anything, but when you're looking at an intervention, if you will, if you're going to do something, right, you want to know, is it safe? In medicine, the Hippocratic Oath is the first part of the Hippocratic Oath is first, do no harm, right? Doctors have to make sure what we're doing is not harmful. Really kind of makes sense, but it is a criteria that all things that we do go through. So we want to make sure when a medicine gets approved, or when a vaccine gets approved, or surgery, or any kind of treatment, is it safe? That's the first thing. Well, the next you want to make sure, once you know that it's safe, you need to know, is it effective? Does it work? If it's safe but it's kind of worthless. So is it safe? Is it effective? And then the third, is it necessary? Is it helpful? Does it meet a need? It really is. Not all interventions are necessary for all populations. For example, I have yet to get the yellow fever vaccine because I haven't traveled anywhere where I might get yellow fever. I know some of you might say like Pflugerville, but thankfully Pflugerville is yellow fever free. So we don't have to worry about that. So we need to make sure that it meets these three criteria.
Great. And is a COVID vaccine safe for someone as young as 6 months old? We're talking about babies here.
Yeah, we are. And so that's when absolutely where we get more concerned, right? We want to be extra careful with those that aren't able to say things, right? They're not able to tell us, yeah, I feel funny, or, I'm losing feeling in my fingers, or things like that. So the younger a population, the more important it is that we do studies to make sure it's safe. And that's why we are waiting on the safety profile of these tests they did on Moderna and Pfizer to see if they're safe. And in general, these studies that were done have shown that they're safe vaccines. So yes, I can say that these vaccines are. There have been some concerns in these vaccines for myocarditis, which is inflammation of the heart muscle. And that has been more noted in the older. This was noted in the 5 to 18-year-old vaccines. Once those were open, it's typically the older patients. There have been some concerns of the Moderna vaccine that might have a little bit higher rate of myocarditis in some Italian studies. And so there's always a little bit of hesitancy, but in general, these are very safe vaccines.
I know that was also a factor when we met as a medical group to decide just to go ahead and go with the Pfizer.
Right, because some of the studies were with Moderna. Now, quite honestly, I think as the studies are better and bigger and more studied, they're going to find out that both Moderna and Pfizer are safe. But when we met to decide this, even though the Pfizer is a little bit more of a hassle for us to give, more work on our part, and also more of a hassle on our families, we thought that any bit of safety could push us in one direction. And that's why we chose the Pfizer, despite the ease of the Moderna. And quite honestly, I don't want anybody to take that as if you've got the Moderna, your kid's going to get myocarditis. It's still a very rare complication. But when we were trying to decide a coin flip, this really helped us decide that.
Right. So we've addressed the fact that it is safe. Right. We are doctors and we do no harm.
Right.
But is it effective?
Well, that's a good question. Is it effective at what? Right? Is it good at preventing, making antibodies? Is it good at leading a patient to develop antibodies for the Delta variant? Yes. Can it prevent severe illness? It's less clear. The studies, honestly, weren't very they were weak. The studies that we were basing things on, the Pfizer and Moderna studies, were very small population numbers, and they had a very small level of confidence, which we call a confidence interval. Like it would be like saying, I think the Aggies are going to score 14 points, but my confidence interval, I'm 9% confidence the Aggies are going to score 14 points, but my confidence interval is like 14 points because they could score 0 points or 28 points. That's a large range. So I'm not very confident in after all. These studies had a very large confidence in the studies could, the actual results could have varied widely. They weren't extremely encouraging on how strong they were.
Okay. Perspective is kind of still open for interpretation.
Right.
Is this vaccine necessary by 6 months to 5-year-old?
So this becomes less clear. So let's first look at the risk of COVID. So many kids are asymptomatic. What percentage of kids who get these illnesses, who are infected with it, it's really hard to know because those without symptoms are less likely to get tested.
Right.
I know some of them are because they're exposed, but really, quite honestly, it's going to be a challenge to really know what the asymptomatic rate is unless we're able to test the antibodies on the entire population.
Which is wasteful, so we don't do that.
Right. So if we want to look at data, 3.3% of all COVID cases to date have been in the 0 to 4-year-old range. Of the deaths, 0.1% of all cases are in the 0 to 4-year-old range. So to put that into perspective, the 75-year-old and older account for a similar percentage of the population, about 6.9%, but they account for 52.5% of all deaths. They've accounted for 453,622 deaths to date, whereas the 0 to 4 age group is 486 deaths. That's 933 times higher risk. So when people say that the disease is disproportionately affecting the elderly, absolutely true. Now, on the other hand, people often say that this disease is like the flu or not quite as bad as the flu. And quite honestly, if you look at the data, at its peak, the influenza virus typically has 90 deaths per year when it's absolute peak. So if you look at 2.5 years, that would be about 220 deaths in that period, 225 deaths. So 486 is higher than 225 because that's a 2.5 year period. So if we try to compare to some degree, now it doesn't look to the proportion of people, like how likely is it to be severe if you get the illness, because I think more people get COVID than they do the flu in a given season. That said, it is incorrect to say that COVID is not as bad as the flu or about the same as the flu, even in the young population. Now, quite honestly, I would say the one we need to be most concerned about, though, is RSV, because RSV, or respiratory syncytial virus, is a pediatric virus, and it accounts for far more deaths than either of those two. So there's no vaccine for RSV yet. That would be one that we're all waiting for. So there are some things that there are hospitalizations, though, and deaths from COVID. Again, it's not as high as the high-risk populations. But there are some populations within that 0 to 4 age range that might help to illustrate or to predict who would have a harder time, have a more severe illness. And these are children with underlying medical conditions. When they looked in large studies, or large as much as they could studies on the patients that were admitted to hospitals and severe illnesses, it was chronic lung disease, it was neurologic disorders, it was cardiovascular disease, it was prematurity, and an abnormal airway. Like if you have a blocked airway, or if you have a tracheotomy, or things like that where you don't have a normal anatomy in your breathing area. Those were the main areas of risk. So for patients that have those risk factors, it does make COVID that much more risky and consequently more necessary for a vaccine.
Okay, great. What about MISC? M-I-S-C.
Well, and so that's another thing that people have looked at. There have been a total of 69 deaths from this. It is something that can happen weeks after an infection. So this concern over that multi-inflammatory systemic condition, it is something that is important to keep in mind as well, with not just a COVID infection, but that too. So, is it necessary? Well, that's a tough question. We do know there is risk to young ones. I'd say bottom line, so, but not as high as adults. I would say it could be helpful, but it's for right now. I'd say it's more in the high risk population.
Okay. So
of pediatrics.
Again, you haven't really answered my first question. Would you recommend this vaccine to a parent of a 6-month-old to 5-year-old child?
Right. And this is where, putting it instead of hedging, actually giving an opinion. The bottom line, and this is the part of medicine that both doctors and patients hate, is that it's not a clear picture. It is not clear cut. There are many things in medicine that thankfully I can say are clear cut. This isn't one of them. The vaccines are generally shown to be safe. There are some concerns, but in general, I think they're safe. I would want to have, but we'd want to have good data on the effectiveness and necessity to kind of outweigh any kind of risks. The studies show positive results, but they were weak studies, and the endpoints not necessarily the best ones. So I'm disappointed in the lack of strength in these studies. It certainly puts more pressure than on the last part. Is it necessary? It continues to become even more clear at this point. I think it really is important to look at how people view risk adversity, have their own personal risk adversity. You're going to have some people who say, regardless, even if everyone should get the vaccine, regardless of the small studies. That would be the CDC and people like this. A lot of people, including people like the CDC and the AAP. There are more deaths than the flu, so it's obvious. I see that side of things. Others say that these studies were so weak and the disease is so low risk that they can't recommend the vaccine yet. They would also point out that they have no idea what percentage of the population has already been infected and had asymptomatic infection and therefore developing antibodies. So is it really necessary then?
I mean, it's easy to see how cloudy this picture really is, but your kids.
Personally, I would say if they have an underlying medical condition, cardiovascular, neurologic, lung disease, prematurity, problems with their airway, things that would predispose them to respiratory diseases and have a more severe complication from it, I think I would recommend getting the vaccine or talk to your provider for their input. If your young one is otherwise healthy and everyone in your family is healthy, there's no immunocompromised person in your family, then I would say maybe you'd want to wait maybe it'd be okay to wait until there are larger studies. And these larger studies, I would say, are going to naturally happen for all those people that are choosing to get vaccinated. When the COVID vaccine originally happened, the first people who got the vaccine were the high-risk population. If you remember, the elderly, those exposed more commonly, those with underlying medical conditions. And so they could absorb more risk, right? They needed that vaccine more than those healthy individuals. And as a result, they were the first in line. They were also the first to get the vaccine and kind of were able to study their response to the vaccine. Now, it did show to be safe for those patients, right? In general, it's a very safe vaccine, and it was effective in helping prevent severe illnesses. So we were able to see that first test group, if you will, expand the number of patients in this study, if you will, an ongoing study. I think the patients that have underlying medical conditions in the 6-month to 5-year age group can be the same way, because they need it, and the risk of them getting it is higher. So getting the vaccine, even with small studies, is a good idea. For those healthy individuals, maybe wait until these studies that are still ongoing are larger and have better strength behind them.
All right. And would your recommendation be the same to a parent of a 6-month-old than a parent of a 4.5-year-old?
At this point, I think they're in the same group.
Same group?
Same
Okay.
group. I would almost approach this like I say it's the flu vaccine, even though it's a little bit more, more dangerous than this disease is a little bit more dangerous than the flu. The flu vaccines have been around a lot longer, though.
Right.
So I kind of think they outweigh each other. So if you're one who gets the flu vaccine, then maybe go ahead and get the COVID vaccine. If you're one who's not somebody who typically gets the flu vaccine, maybe hold off on this for now.
Okay. So there is a specific reason why we at Chisholm Trail Pediatrics are offering this vaccine.
There's a couple. First, there are families that we take care of that have underlying medical conditions, whether it's the patient or there's an immunocompromised family member. So I think, yes, for those families, it's an important thing that we offer it to them. Also, we also want to offer it for the families that they decided to want to get the vaccine. Again, this isn't a clear picture. So I'm not saying that those people who believe in everyone going from this age group getting vaccines are wrong. But where we stand is that it's not yet clear. So if you have read the data, if you've heard a lot from the CDC and the AAP, and you're ready to get the vaccine, we'll support your decision in that.
Excellent. And be on the lookout for information from Chisholm Trail Pediatrics, because we are going to get this vaccine. We are going to offer it to our patients, and we will be scheduling soon. So keep an eye out on the emails. Give us a call at either one of our branches if you want to schedule one of the shots, or if you want to be seen by one of our providers in Town, please give us a call. I'd like to thank Chisholm Trail Pediatrics for presenting this today, and our producer Emily Littleton for making this happen. Also, a big shout out to Jimmy Vegas Smokehouse. We both had the BLT today.
Yes,
and it was pretty dang good, huh?
The best BLT I've ever had.
Seriously,
like you said.
guys, you got to come try this stuff. It's really, really good. Jimmy's doing some really cool stuff with barbecue over here in Georgetown. But great. If you have any questions about the COVID-19 vaccine, please contact one of our offices. If not, I would like to say thank you to everybody. Thanks to everybody for listening in today, and please stay cool in this hot summer, and we'll see everybody next time.